I would like now to present Ulrika Ådén, a professor at Karolinska Institutet. And as we already know, we're going to hear about this kangaroo project. I think, Ulrika, you have really taken an interest in these premature babies and devoted your research to try to find ways to help them develop as good as possible. Isn't that so?
Yes. So I don't exactly feel like a noise researcher, but I work in a very noisy environment. So I work with the tiniest little babies, and I'm interested in how their brains develop. And recently I got interested in music because Pernilla Hugosson, who's a music therapist, came to me, wanted to do a research project. And then I got to know Minna and Vineta, who came up with this idea about this singing kangaroo project in the neonatal wards. It's a joint project between University of Helsinki, as you understand, and University of Jyväskylä, where Pernilla is a PhD student, and Karolinska. So my view is that I'm just looking for the pointer here. So this is beautiful fetal imaging, MRIs of pregnant women from Kostovic. And this is at 12 weeks gestation, when most women are starting to tell everybody else that they are pregnant. Then the brain is just a little vesicle here, up until 40 weeks, when most babies are born, where it's a beautifully, very complex structure here. And the babies that I take care of, they are right here in brain development. So you see there is a very smooth surface area of the brain, very little gyri and sulci. There is a whole lot of growth that needs to be done during this period of time, the third trimester when they are in our unit. And what is happening, all the nerve cells have been formed. They have moved to the right place in the cortex, but they're just about to start getting into contact with each other. And the big roads for connections are being myelinated, so the broadband is being built in the brain, and some small networks are being formed, and the networks that are usable will stay there, and those that are not will die and be retracted. So everything happens during this period of time. And we believe what we do in the unit might have importance for their brain development. So that is really my perspective. And this is Gabriella. She's born at week 26 out of 40 normal weeks. So it's 3.5 months before expected date. She's very good because she doesn't need to be on the ventilator, so she breathes on her own with a little help from the CPAP mask. But you can see she's very fragile. She's exposed to a whole lot of different stimuli, which is unnatural for her. She's exposed to light and noise and pain and all those things. And I should say this is from Paul Hansen, who's a photographer at Dagens Nyheter. He got the prize for this series of images. So when we put these babies into the magnetic resonance scanner, MR scanner, we see that, I don't think you believe that after hearing Minna's talk, but some people might have thought that the baby brain is just blank, but it's not. So babies in the scanner have a whole lot of brain activity. But it looks different from the adult brain, because when we are scanned, if we just lie still there thinking of nothing, our higher mental processing networks are active. But in the baby brain, it's all about sensory information. So we see the visual network here, we see the sensory motor network, and the auditory network. So they are all on, they want information from the environment, and they want to learn, just as Minna says. And now we know that these connections from different senses are really processed at the highest stage in the cortex in the brain when they are like 26 weeks gestation. So the sensory information goes in here through the thalamus and then up to the cortex, and they are forming those small networks here. There's also another pathway for the auditory cortex. But we know that the development is clearly driven by nerve activity. So electric activity here in bursts, this is what shapes the brain. So Carla Schatz, a well-known neurobiologist, said that cells that fire together wire together. And for the auditory pathway, I think it's beautifully shown by this experiment when they imaged then fetuses in the womb in the MRI, and we're looking at this red signal, which is the blood oxygen activation signal. And they exposed them to noise outside the womb and immediately found this response. And it's so selective, specific in the auditory cortex. So the pathways are there, they are working, just as Minna says. And this is again Gabriella, she's in the neonatal ward. We try to keep them skin to skin or at kangaroo care as much as possible. We believe that is meaningful and quite natural sensory stimulation for them. And we also believe that the type of relation that it contains for the baby to be with their parents there is very meaningful for them. But still, it's a very noisy environment. It's high tech, really high tech, and we need that in order to be able to keep them alive. And this is a quite funny study that came in PNAS 2 years ago on preterm babies in the intensive care unit in incubators. And when you look upon being in an incubator like a separation from your mother's body, and then you add on the missed stimuli. So what they did was that they recorded mother's voice and heartbeat and played it inside the incubator thousands of times during a day. And then they measured the brain volumes using ultrasound. So they found that actually in the left auditory cortex there was an increase of the volume in the babies that were exposed to maternal voice and heartbeat, as opposed to the controls. So that shows us that, again, what we already know, the brain development is driven by the sensory experience. So here is Gabriella, from Gabriella's perspective, inside the incubator, seeing her sisters and mother here. And there's been a concern about the environment we have in the intensive care unit for neonates, because it's unnatural for many reasons, but the sound environment is obviously conducted by air, and there's a direct exposure, there's a broad spectrum of frequencies, and there's a lot of unnatural sounds, alarms, and so on. Again, there are less exposure to natural stimuli like language that they would have heard in the womb. So we are concerned about how that contributes to their neuroplasticity in the auditory cortex. And Minna showed us some evidence that it might be different. And I thought I just had to look that up yesterday, because I thought you might be interested in what are then the noise levels. I didn't know, but there is a recent study comparing noise levels in a normal intensive care unit for neonates and the new type with less beds in it. So we can see that there's a range between 45 and 50 dB, usually up to a little more than 50. There are peaks at 75 dB, so it can be really noisy at times for these babies. And the type of intensive care unit we believe affects also the baby brain development. And we've been very much into creating private rooms or family rooms in this field now. And this is a very interesting study from St. Louis. So they started building private rooms, and that sounds very good, doesn't it? Yeah, we want to have a private room, of course, rather than an open ward, which is, all cots here and lots of noise and disturbing things. And then they looked at the baby brains at 40 weeks, when they should have been born, and they actually found that the ones in the cared for in private rooms had less gyration of the auditory cortex on the left side. And they also had more language impairments at 2 years of age. And that was surprising. Why would that be? And then they went back to look at who were there and what happened during the neonatal care. And it actually showed out that these babies in the private rooms, in the US now, in St. Louis, they were actually alone there because their parents could not afford to be with the child. So they were actually sensory deprived. We have a completely different situation in Sweden, so I'm very grateful to work in Sweden when we have this social security system. But I should say that in the US they've also shown that if you actually have a language stimulation program in these private rooms, you can get an improved language development. Because we know that language impairments are very common in the preterm born. So we're looking at those who are extremely preterm born, so that is more than 3 months before expected date. A majority have problems in understanding the language at 2 years, and a fourth of them have problems in expressing the language at 2 years. And we thought that, they are just a little bit late, but maybe that's not the case. There are new studies now showing that this impairments actually persist until at least 8 years of age. So I think we need strategies to give an early support to language development in these kids. But it's more complex because it's not only language impairments. There is also problems with communication. So we have many children with autism spectrum disorder traits. 14% of the extremely preterm have a diagnosis at age 6. So it's complex. It's about the holistic brain development. And Karin Stjernquist and Johanna has worked a lot on the cognition in preterm babies, and we also know that IQ tests are normed at 100, and for every week less than 34 weeks that you're born, you lose a few IQ points. So the babies that I look after, they are around here in the lower normal range. So this is the Swedish system. So we let both parents have sick leave for the entire period of time they stay in the intensive care unit. And that's fantastic. And we can see here mom and dad having a twin each, skin to skin. This is their job. This is from Danderyds sjukhus in Stockholm. They spend 8 or 9 hours every day like this. And we believe this is a good multisensory experience. They feel the skin-to-skin contact. They feel the vibrations in the thorax. They hear the heartbeats, and they smell their parent. We believe this is the natural stimuli for them. But then we were inspired by Minna and Veneta's idea here to work together on whether music could add anything in this context, in this multi-sensory stimulation. So, there is a whole lot of research done in neonatal intensive care units and music therapy. I've learned that from Pernilla. And there's actually a meta-analysis showing that we really have good effects on the autonomic stability, meaning, more stable heart rate, better oxygenation of the babies. They are more stable in the intensive care setting. But we don't know so much about the long-term effects. And actually, it's the same thing with the skin-to-skin contact, same effects on autonomic nervous system. But there is some evidence also that the maternal voice has a special meaning for the baby. And it's also shown that maternal singing during this kangaroo care actually stabilizes the baby even better and also soothes the mother. As always, it's mutual. And so the research questions for this study, the singing kangaroo study, is because it's Sweden and Finland, we also want to involve not only the mothers but the fathers, of course. So does parental care singing during kangaroo care improve, first of all, auditory skills measured in the cortex, just as I will explain, but Milla has already explained some methods, and then in the long-term language and neurodevelopment, which is tightly coupled. And we're also very interested in the attachment to the parents and whether it will help the parents as well. So, and it's ongoing, so I have just some preliminary things, and our aim is to include 160 babies born more than 2 months before expected date, and their parents, and then randomize them to control and intervention group. And what is then the intervention? Well, skin-to-skin care is standard care, but the thing is that they get into contact with the music therapist, and Pernilla goes to them 8 sessions during 4 weeks to talk with them about how they can use their voice, singing lullabies or singing whatever that they feel is right for the baby right now. And they learn from you how to interpret the baby's needs at that moment. So it is an infant-directed singing. It's a communication. It's not just music. It's not a recording. It's something that happens at that time between the parent and the child. Okay. And the controls get standard care, including skin-to-skin or kangaroo care. And they have a diary. How many minutes have I sang today? And we try to validate them because we record them also sometimes over 24 hours. And it's not completely easy to distinguish between language and singing in those recordings, but we're on our way trying to do that. So here's Pernilla together with a mom and her baby. And this is Kaisa-Marie, who's a music therapist in Helsinki. Our outcomes are then, primary outcome is auditory discrimination by EEG or magnetic encephalography at term when they should have been born. And the secondary outcome is language and psychomotor development, 2 years. And we also assess the attachment and interaction between child and parent, and look at the parental anxiety and patient's experiences is something that Pernilla is assessing right now. They seem to like it, Pernilla, for some reason. So this is a mom that has approved to Pernilla that we can show what it looks like when she sings to her baby. So we'll see if we can get it going here.
Var bor du lilla råtta i en hatt? Vad gör du klockan 8? Jag är katt. Hur många ungar har du? 72. Hur mår din gamle far då? Si och så.
Hon log precis.
Vad gör din fru då, visa? Steker glass. Vad vill du ha att spisa? Korv och jazz. Vad vill du ha att dricka? Smultronboll. Vad har du i din ficka? 4 hål.
Yeah. So Dad was in there as well. You heard him. Yeah. So it's fantastic for the parents when they feel that they get a response from the baby, and so it's reinforcing behavior. And so that means they do sing a lot. And these are some preliminary data on how they sing, and these are here the intervention mothers and intervention fathers. So intervention mothers, at least, they do sing a lot more than controls. Okay, I should finish up. Okay, so we do have some preliminary data from Meg, but maybe I should skip that. So, in essence, we've established this music therapy intervention, and they do sing a lot. We don't see any side effects. We have set up the paradigm for looking at the auditory cortex responses using MEG in Stockholm, and we are now starting to look at the long-term outcomes. And the goal is, of course, to establish good behaviors between parent and child, and that those behaviors would be reinforcing and stable over childhood. That would be really the dream. So I'd like to thank you for the attention.
Okay, thank you, Ulrika. Some lectures you just never want them to end, really. Amazing. We want Minna to come up, and we can have a few questions, and then we'll go on. Have to go on. So, is there any questions? Anybody? Yes, Karin.
Congratulations to very good research, both of you. And just a small question: how do you measure attachment?
Yes. So. Pernilla, you have got in contact with Lisa Lehtonen's group, and you were discussing looking at PCERA, but I think we are open to...
the PCERA. Yeah, are we going to use? Yes.
No, I know. Okay. I'm running around because we have this hearing thing, so everybody has to talk in the microphone.
One short question more. Yes.
Okay, there's actually two, but I can start with the one that I'm... have you looked at anything when you include the fathers singing as well? Have you analyzed any differences depending on the pitch of the voice? The fathers probably being quite a lot lower than the mothers.
Interesting question. No, we haven't, because we have too few babies at the moment, so we cannot divide the groups. Okay. But there are a number of things with the fathers. They smell differently, and they so we really need to look at the fathers. I think so. Yeah. Yeah.
Okay, I think that what time allows now. Thank you very much, both of you.